Our health communication is aimed at reducing hepatitis A among homeless adults in downtown San Diego. A hepatitis A outbreak started in November 2016 and has continued to grow among our target population of homeless adults in downtown San Diego. As of August 1st, 295 people have been infected. 68% of those have been hospitalized and 10 have died. That's more than a 1,500% increase since 2011. In comparison to the general population, homeless people have a higher morbidity and a higher mortality due to hepatitis A. 70% of all confirmed cases are homeless. Hepatitis A is a viral liver disease that is generally spread from the fecal to oral route by sharing food, drinks, or cigarettes. Typically when an infected person fails to wash his or her hands after using the bathroom. The incubation period ranges from 15 to 50 days, and symptoms usually last for at least 2 months, although 10 to 15% of symptomatic persons have prolonged or relapsing diseases for up to 6 months. Hepatitis A can sometimes cause liver failure and even death. Symptoms include fever, fatigue, nausea, vomiting, loss of appetite, jaundice, dark urine, pale stools, and diarrhea.
The most effective prevention for hepatitis A is a series of 2 vaccinations 6 months apart. The vaccination series is effective for 25 years. The risk of hepatitis A can also be reduced by washing your hands for 20 seconds after using the bathroom. Our target population of homeless adults in downtown San Diego number approximately 1,300 people, 85% of which are over the age of 25, and 69% are male and 31% are female. A 2016 survey showed that 35% are non-Hispanic Black, 37% non-Hispanic White, 35% Hispanic, less than 1% Asian, less than 1% are American Indian or Alaska Native, and less than 1% are either Native Hawaiian or Pacific Islander. A previous study also showed that non-Hispanic white homeless were the least likely to complete their vaccination series.
Despite the evidence that shows vaccinations prevent hepatitis A, homeless adults face several barriers to vaccinations, including a lack of transportation, lack of health insurance, and a lack of education regarding the importance of vaccinations. Previous research has shown that vaccination compliance was greater among homeless when they were also educated about the benefits of vaccinations. 68% of those who received the education completed the series, compared to 54% who did not. Homeless people also reported feelings alienation from health promotion materials because they often require high levels of literacy. Previous studies have also shown that the majority of the homeless would get immunized if vaccines were readily available and easily accessible, but they would not go to lengths to get a shot.
Our goal is to decrease the prevalence of hepatitis A among homeless adults in downtown San Diego. Our first objective is to increase the perceived susceptibility to hepatitis A among the homeless population through posters, face-to-face communication, pamphlets, and an infographic. Our second objective is to increase the perceived benefit of completing the hepatitis A vaccination series among homeless by educating them about the protection provided by vaccinations through face-to-face communication, pamphlets, and an infographic. And our final objective is that 70% of the homeless that receive the vaccination will report that our health communication was their cue to action. To reduce the prevalence of hepatitis A among homeless, we are using the health belief model as our guide. A lack of awareness regarding the mode of transmission is likely resulting in a lower perception of the susceptibility to hepatitis A among homeless. Homeless not only frequently share food, drinks, and cigarettes, but they also lack access to soap and water to wash their hands after using the bathroom. The perceived benefits of vaccinations may be lower among homeless due to a lack of education, which according to our target population is likely due to the literacy level of the health promotion materials. Designed to overcome homeless barriers, increase the perceived susceptibility to hepatitis A, and increase the perceived benefits of vaccinations, we believe that our health promotion will serve as a cue to the completion of the Hepatitis A series by homeless people in downtown San Diego. Based on our objectives and the barriers that homeless adults face, we felt that a good method would be to inform homeless about the outbreak, their susceptibility by sharing food and beverages, the benefits of the vaccinations, and the availability of free vaccinations provided by mobile clinics. The mobile clinics overcome transportation barriers, and the free vaccinations overcome the insurance barriers. Literacy barriers are addressed by using materials written at less than a 5th grade reading level and the use of simplified illustrations on both the pamphlets and the infographics. The face-to-face education, mass media pamphlets, and the infographic will be used to address the lack of education regarding the protectiveness of the vaccinations. This is an overview of our materials. All of our mass media materials will be written at less than a 5th grade reading level, use simplified illustrations, and be printed in both English and Spanish. Mass media include posters distributed in areas frequented by adult homeless in downtown San Diego, pamphlets provided during the face-to-face education, the prevention label on their sack lunches, and the label on the hand sanitizer with the reminder date for their second shot. Our face-to-face communication includes an education script presented prior to and during their vaccination.
We will increase the perceived susceptibility of hepatitis A among homeless through the posters seen here. The posters include an image that we feel homeless can relate to. According to the Community Toolbox, people often respond to pictures of people like themselves.
Keeping in mind that homeless participants in a previous study reported a need for better advertising of both the time and location of free immunization sites, as well as their suggestion to advertise in public locations, we will be placing posters on various locations in downtown San Diego, including light posts, similar to the one seen here, utility boxes,
and park benches.
The susceptibility of homeless to hepatitis A will also be presented via face-to-face communication provided before their vaccination.
Through a pamphlet provided to each participant. And by the infographic seen here, which will be posted inside the mobile clinic. The benefits of the vaccination will also be communicated in the pamphlet, as well as through face-to-face communication by the nurse administering the shot. Our health communication addresses the needs of each of the different learning styles. We are meeting the needs of kinesthetic learners by providing information in chunks before and after the vaccination, having participants move from one location to another, and providing the hand sanitizer labeled with the reminder. The needs of auditory learners are met by having the information explained to them and having written material that they can read out loud on their own. The needs of visual learners are met through the simplified graphics used on the pamphlet and the infographic. Additionally, we will have highlighters available for those visual learners who like to outline important information. In summary, our health communication is aimed at reducing the prevalence of hepatitis A among homeless adults in downtown San Diego. The materials were developed using the Health Leaf model. We use posters, pamphlets, and an infographic to increase the perceived susceptibility to hepatitis A, and face-to-face communication, pamphlets, and an infographic to increase the perceived benefits of the hepatitis A vaccinations. Lastly, we use labeled lunches and hand sanitizers to increase their vaccination compliance.